Welcome back. You know, one cardiologist says that he's never met a patient who expected to have a problem. You know, they don't put in their diaries, possible problem with my heart next week. But he also says, what if we could be forewarned? What if we could plan not to have a heart attack? Let's ask him all about them. Welcome, Dr. Warrick Bishop, #1 best-selling author of the book, Know Your Real Risk of Heart Attack. Doctor, thank you so much for coming in.
Thank you for having me.
Already, that makes complete sense, and everybody else would say, yeah, that makes sense. But I have to ask, what kind of started your journey to want to help us with a book?
Sure. Well, look, as you're probably aware, most of the time cardiologists are people you see when you've had a problem.
Yeah.
And that was how I was trained, and that's how I really practiced and dealt with my patients. But something changed back in 2005. I was literally just driving to work on a weekend. There happened to be a local fun run going on. As I was driving past, I noticed there was a commotion by the side of the road, an ambulance and a gathering of people. And just being a doctor, I thought, oh, well, I might stop and see if I can help. It turned out a man had literally dropped dead during the fun run with a heart attack.
Oh.
I helped in that man's resuscitation. He had a great outcome. There was also a nurse and a GP who had stopped by, plus the paramedics. He got to hospital, he had a stent put in his artery. He did so well, he was on the front page of the paper a couple of days later. And with a little bit of pride, I took the front page of the paper into my office a couple of days later and showed my staff, only to have my staff point out that I'd seen the very same man about 18 months earlier, and I'd reassured him he was fine.
Oh.
Now, the assessment I'd done 18 months earlier was a treadmill test and standard risk assessment. And at the time, that was the best medical practice we had available. But it made me realise, Tina, that that's just inadequate. This man nearly died. He nearly died, and I'd had the chance to see him 18 months earlier. Now, what that meant was that I was open to change and open to looking at what might allow us to be more precise. And literally over a course of a couple of years after that, technologies have moved on, and you don't have to look beyond your phone to realise how quickly technologies move.
Yeah.
So really, I in fact wrote a book to try and discuss where technology currently is and where current practice currently is, because the technologies move so quickly, most doctors aren't aware of what's available. Now, some people do know about this current technology, and I think before we went to air, I was telling you that US presidents and astronauts currently are using this technology. But I think there's a real space for individuals who want to be proactive about their own health to know the questions to ask of their doctors to see if that technology is for them.
And we say that a lot here on the Morning Blend about taking some personal responsibility, knowing, getting a little bit of research on your own, like your book. What are some of the things that we can kind of do now to prepare us?
So look, it's really important not to forget what we call our traditional risk factors, and that's blood pressure, smoking, diabetes, and we could all name those, eating well, exercise, etc. But what I've written about is whether imaging the heart and actually taking a picture of the arteries to see what the health of the arteries is like, see if that's relevant for an individual, and that's an important conversation.
Okay.
And in fact, I've covered all the pros and cons in my book, so that if, for example, an individual's doctor wasn't quite up to speed with this technology, then at least the patient can bring a balanced perspective and have that conversation.
And we kind of also mentioned before we started about somebody looking physically just fine. But again, this goes back to that, knowing what's really going on the inside. You mentioned blood pressure. What about like statins, things that we should probably know a little bit more about?
Sure. So look, the fun runner who I just told you about, he put on his sand shoes that morning thinking he was going to run 10 kilometres and drop dead. He didn't plan to have a heart attack. And he was fit. He'd trained up for this. And so being well on the outside isn't a guarantee, and people have to understand that. We have so many examples. President Clinton was running only days before he ended up having his bypass. And so you can look well on the outside, but the arteries may tell a different story. When it comes to taking statins and blood pressure therapy, the questions around that are really based on a holistic risk assessment, but one of the things we can put into that holistic risk assessment is imaging of the heart. Very important, and I believe it's life-saving. The thrust of the book is to save lives by preventing heart attacks.
Absolutely, and that's what all of us should be doing right now. Getting the book, knowing what to ask, knowing what's available to us, and knowing what we can do to, again, forewarn, you know, what is going on. I'm going to tell them how to get a hold of this book, start on that journey. Doctor, thank you so much, and thank you for expanding your knowledge to all of us.
Thanks, Tina. Thanks for having me.
That's wonderful. Everyone at home, to learn more about Dr. Bishop or his book, Know Your Real Risk of Heart Attack, please visit drwarrickbishop.com.